Welcome to a couple of Rad Techs podcast where we bring you an inside look at the world of radiology from the unique perspective of a married couple of radiologic technologists. Together, we have years of experience, exactly 30 years in the field, and we are here to demystify the science of medical imaging. Radiology is the unsung hero of the medical field, providing doctors with crucial images and information that help diagnose and treat illnesses. Join us as we explore the latest techniques, technologies, and innovations in radiology and discover the vital role we play in the healthcare industry. So come along for the ride as we share our passion for radiology as a married couple. But before I get started, you guys, really briefly, I want to show off my mug, and I want to make sure I thank someone very special. I have a follower on Instagram that actually gave me this mug, and it is the title of my podcast, A Couple of Rad Techs. And she gave me this beautiful, beautiful mug, and I love it. I'm going to be drinking my water during my podcast out of it. So if you guys want to support a female business, small business, single mom, amazing business owner. This is the fall time, and we are all putting these beautiful decorations on our front porch. My neighbor was out earlier today wrapping all of her fall flowers and decorating her front porch. And may you do the same. And Wakira Soto, I will put her information in the description so you can easily contact her if you want to decorate your porch or get one of these beautiful mugs for your home and for your loved ones. Well, today we're going to talk about breast health and breast awareness because we are in the month of October. My name is Chandria, and I am the host of A Couple of Rad Techs podcast. I am a 21-year veteran of the medical imaging profession. I've been doing radiology or medical imaging for 21 years now. August was my 21st anniversary. That is hard to say. But I feel like I just started yesterday. It is a wonderful profession. We are the third largest medical profession in the nation. I'm wearing my pink for October awareness this month. And just want to bring awareness to not only this month for women, but for men as well. And we have an amazing guest, Jen Santiago. She is the expert. I bring you guys great experts. I can do screening mammos, but that is about it. And MRI breast. I really want to bring this topic to life so you all can hear firsthand of people that do this on a daily basis. So Jen, welcome to our conversation here on LinkedIn.
Thank you so much for having me. I'm so excited to be here with you this evening.
Well, I want them first to know who you are. I gave them your name and a little bit about you, but tell us who you are, how you got into mammography or medical imaging, highlight your credentials, your roles, and we'll get on with the conversation after that.
Perfect. Yep. I am Jen Santiago, and on Instagram, I am at mammo_mama. So all things mammography, breast health related. I am a mammo tech of 13 years, and I absolutely love it. And I'm also a adjunct mammography professor at Weber State University, and I've done that for 6 years. My credentials is I have my ART license, so I'm an X-ray tech, and then I specialized in mammography, and then I have my master's in radiology as well. So just kind of dive deep right into the radiology field from the beginning. How I got into it was I broke my arm when I was 8 years old and was absolutely fascinated by x-rays. I thought it was so cool. And ever since then, I said, I'm going to be an x-ray tech. I want to do x-rays. And the rest is history. Here we are. So that's kind of my story.
I know for me, I had a lot of gut issues, and many of us got into radiology because of our history. Maybe you had a broken arm. I had barium enemas. I had swallows. I had all kind of GI issues growing up, and that's how I kind of learned about radiology a little bit. I didn't really know what it was. But for me, my history with breast cancer is familial. My family line has been plagued with breast cancer. As I spoke last week, my cousin, she lost her battle at 32 back in the 80s with breast cancer. I have 5 great aunts who passed away of breast cancer. My grandmother died of ovarian cancer. And this is all on my grandmother's side. And we talk a little bit in these conversations about not only is Breast Cancer Awareness Month about breast cancer, but some of the radiologists I'll have on, and you could probably attest to this too, that when you have strong cancers like that, breast cancer, it can also be genetic and lead to stronger cancers later. So, Jen, talk to us and set the stage for this discussion about breast cancer awareness and mammography. We're going to talk about this awareness month, but what is, in your opinion, the significance of October as the breast cancer awareness month?
Yes, it is huge in mammography. We, in our clinic that we do during the month of October, we double the amount of patients we see on a daily basis. And that makes us so happy as techs. We double the amount of workers, of techs that we have working to accommodate the number of patients coming in. And like I said, as technologists, that makes us so happy that women are taking the time to come in and get screened. So it definitely does its job of bringing, awareness to the community, to women. And we just want to see those numbers not just increase during October, but to stay up during all times of the year. I think one thing that's fun with October and mammography is a lot of places will do fun decorations and treats. And I know our clinic, we always give a gift. And so I think that's kind of a fun incentive for women to come in during October. So it's always just a party the month of October during mammography.
And I think that is important because you have to kind of create excitement around this month. Before, after, it's like an ongoing thing. For me, it's wearing earrings, it's talking about it, doing lives like this. I wear my pink scrubs. I have my little socks with the bows on it. I have sweatshirts because sometimes it's cold around October. Just depends what climate you're in. And people see like my shirt or see my pink and see my ribbon and say, oh yeah, I didn't get my mammogram. I didn't get my breast ultrasound. I usually, they'll have conversations with me in line. I get breast MRIs. I mean, like they'll just in the grocery store line, they'll see my pink ribbon. So like you say, creating fun events around it, because this is a scary time for many people, especially if you've had maybe an experience or not had an experience and you just heard about it and it scared you, or you have family history, or you just hate the big C word, right? But what statistics, you've spoken a little bit about the statistics and importance of breast cancer awareness. You've seen a decline because of the awareness that's being brought around breast cancer awareness. What about for men? Do you guys see more men now than you did before?
We do. So I would say, so let's kind of talk statistics. So I'm sure everyone's heard the 1 in 8 chance of women getting breast cancer. So that's about a 13% chance risk. Men have about a 1 to 3% risk of getting breast cancer. But we see men in our clinic, I would say several a month, because men can get breast cancer. And there's other factors other than breast cancer that can, cause men to need to come in and get a mammogram. They should also be doing self-exams as along with women. And so if they feel a lump or if they feel pain, sometimes that can be a side effect of a medication. There's a thing called gynecomastia where men develop breast tissue, and that's a common side effect in some medications. And so we have men in our clinic all the time coming in for pain or a lump. And so most of the time it's usually not cancer, it's gynecomastia, but it's still so important that men are also aware that they can get breast cancer.
That is really important because I think a lot of men don't think, and we talked last week, I had a mammography tech on, and we kind of showed people the breast tissue, what it covers, up to the clavicle, into the underarm, down into the abdominal area. Most people just think the breasts that kind of stick out. But even for men, are you seeing maybe the age get younger that people are coming in for mammos or for breast health issues?
Yes, most definitely. The risk and the occurrence of breast cancer in younger people is definitely increasing, younger patients. And so that's just more of a reason why that recommendation of starting at 40 is so important, because we're seeing it in younger women. It used to be a postmenopausal, not till you're 55, 60, and that 40 was kind of that baseline preventive, okay, we'll catch things, before. And now we're seeing things, 40 on their first mammogram and they have a small cancer. So that's why it's so important, that 40-year mark of getting in there for if you're a regular risk. That recommendation is at 40.
Yeah, and it's so interesting. I was 24 with my first lump, 24 years old, and I wasn't getting mammograms at that time. Wasn't even getting breast ultrasounds. That wasn't even on my radar. but I did self exams on a regular basis. Like it was drilled into us growing up because of our family history. But one thing we're seeing now with the minimal breast that I do in MRI breast is younger people, definitely with lumps, and sometimes going where they ignore those lumps, thinking they'll go away, or or I'm just going to ignore it. They're not that painful, or they're not painful at all, so I'll just ignore it. What advice would you give? I know what I would say, and what has helped me to find my lumps wasn't going to the doctor always. Sometimes the lumps for me appeared after I went and got my check. I found them myself. What would your recommendation be, especially the emphasis and the importance on regular screening? So maybe you're not at that age where you get screenings yet. What would be your recommendation?
Yeah, that's great. The most important thing with doing self breast exams is becoming familiar with your breasts. As we have our cycles with our menstrual cycle, there's going to be hormone changes, and you're going to have a time where your breast tissue is more lumpy, and you might feel that lump, and then it will go away. And so you need to become familiar with the breast and where those lumps are. But when in doubt, always go and talk to your physician. Ask for an ultrasound if you're younger than 40. Ask for a mammogram. Be an advocate for yourself and for your health. There's a great app if women who are not of screening age yet. It's called Know Your Lemons. It's an app, and it will teach you how to do self breast exams, and it will send you a reminder of when to do them. And it's also then for women who are time for their mammograms. It will tell them when to do their self check every month, and then when to do your mammogram. So it's a great app, and it will show them, like you said, the areas to check. It's a lot more than just a little bit. So fabulous, fabulous app to download to become more aware of the self breast exam.
Say that one more time. Where to find your...
It's called Know Your Lemons.
Know Your Lemons. I'd never heard of that website. See, this is why we have the professionals on here to talk. They know these specific things. Thank you so much for that. You guys, please check that out. I mean, it does not hurt. I'll tell you, for me, I had just come from the doctor and gotten my whole exam. Everything, it was clear. And like you say, between those times where you have hormonal changes, and if your body is going through, we just go through hormonal changes all the time. But when you're familiar with your body, a doctor might feel something and they're not familiar with your body, especially maybe it's a new doctor. Maybe they're just getting to know your breast, but you know your breast if you've been doing these things. And if you don't know how to do, if someone doesn't know how to do self breast exams, what would you recommend that they do? Hey, you guys, as a radiology technologist, I understand the ultimate task of radiology technologists to bring that coffee into their department every morning without spilling it. So I'm going to introduce you to Bevy. Bevy is perfect for this kind of occasion. If you've got the responsibility of bringing in that much needed coffee to your colleagues in a radiology department, have no fear. Bevy was designed just for us rad techs. It's a problem solver to carrying more beverages than your two hands can hold. This beverage carrier can hold up to 12 drinks securely, spill-free, and fits perfectly in your car. You guys, no more spills, no more accidents. Bevy's innovative design keeps your drinks in place even during the most hectic mornings and as you're trying to carry everything in. And the best part, Bevy is proudly owned and operated by a woman. Join the growing community of satisfied Bevy users and experience the convenience and peace of mind you deserve, and your radiology coworkers do too. So don't let spills slow you down. Get your Bevy drink holder today. Keep your coffee and drink secure before they get to the radiology department. Get 20% off too. Use my code RADTEX20.
So yes, first, like I said, this app is awesome. This is a great thing. Second is talk to your doctor. And I think the other thing we need to do is, as a community, we need to kind of release that taboo of talking about mammograms, talking about self breast exams. It's part of our body. We don't, get embarrassed by talking about, oh, did you check your thyroid? Did you, we don't get embarrassed about that. And so I think there's we just need to get over that taboo of talking about breast exams. and asking our neighbors or our family members and our neighbors, hey, have you done a self breast exam? Like,
Mm-hmm.
how do you do one? And that kind of stuff. And as we become more aware as a community, we're going to be more comfortable talking about these things and more knowledgeable. And education is key in health and everything, but especially, in this type of field.
I like that point because we do talk a lot about our thyroid. We talk about poop. We talk about our hair. We talk about our makeup. But how often do we as women and men sit and talk, husband and wives, they'll make their appointments for prostate health and colon cancer. But what about talking to your husband and your sons about their breast health and your daughters, teaching your daughters how to do those things? I think that is a great conversation to have in families. So maybe in the month of October, we can encourage more families to do that and women and families to do that with each other. So we're going to have some basics because we got to get down to the basics. Would you explain your role as a mammography technologist?
Yes. So my role as a tech is kind of the link between the patient and the radiologist, the doctor that reads the mammogram. So we first take a family history and a personal history of all of the patients that come into us. And so that's where, like you talked about, knowing your family history of breast cancer and other cancers will play a role into that. And so we as the technologists will ask those questions and then we perform the x-rays. And so our job is to position the breast, and we go through lots of schooling to learn how to position. There's actually quite an art, and everybody is so different. Every breast is so different. And so getting all of the breast tissue in there on each person, it takes a lot of work, takes a lot of practice. And if you miss just the smallest amount of breast tissue, there could be a little cancer that was missing. So there's a lot of practicing and getting that tissue in. And then after we take the images, at the time, the technologist is looking at the image to make sure we don't have motion on the picture. We're making sure we have all of the breast tissue included on the image so that the radiologist can read and see everything that's needed. So I know a lot of times patients, and I'm sure you can relate to this with MRI patients, a lot of patients will ask us, oh, what do you see, or what can you tell? And we don't see, we can't say anything, but, the tech will probably say, oh, we got great pictures. Oh, it looks good, meaning we got everything the doctor needed, or we got clear pictures. And so that's our role as the tech, is to communicate, get all the good pictures and then communicate everything from the patient to the radiologist.
That is a great explanation. And yes, across the board, we're always asked, do you see anything? And it's like, I have this funny video that I did on Instagram where, the little eye mask they give you for MRI to cover your eyes if you're claustrophobic. So the patients ask, did you see anything? And then there's this sound that says, I can't see, I'm blind. And so I just put that mask over my eye. People thought that was so funny. And like people commented, like, I always ask the tech, do they see anything? And they always tell me they don't see a thing or they can't tell me. So they thought that's so funny. I like to try to bring education and entertainment together. And I feel that kind of resonates with the majority of people and technologists as well, because we're patients too. But as a mammography tech, I think it's important that people understand not only do you just take imaging, because I have done the schooling for, and I'm going to tell you guys, she is not joking when she says you have to get every piece of tissue. And remember, the breast is up here, inside of there. And if you have deep cavities on your underarm and the tissue goes back there and you have smaller breasts, I personally thought the smaller breasts were harder. I'm going to be honest with you. They were harder. I was sweating like I hadn't worked so hard in my life until I did mammography. And that was just the technical part. There's a lot of paperwork. And I really want people to understand with mammography, there's a lot of QC or quality control that goes along with what technologists have to do. So we're not just taking pictures of your breast. You just put them in there, squeeze, you'd go, boom. There is patient QC they have to do. I'll let Jen tell. What is this QC? What's the paperwork?
Yeah, so mammography is regulated by, it's called the Mammography Quality Standard Act. So a lot of regulation, a lot of kind of rules and policies to make sure that the equipment is the best, and that the positioning of the technologist, that the education of the technologist and the radiologist is the best. And so we are regulated by the FDA. So every year we have an inspection by the FDA, and they come in and they look at every week. We do quality control tests on the machines where we make sure that the x-rays are being produced at the right quality, and the machine's working how it's supposed to. And these inspectors come in and they go with a fine-tooth comb, kind of go through all of our paperwork, all of our documentation on the machines. They make sure all of the technologists have all of their credentialing. It's a lot, and it's the only modality in radiology that is so heavily regulated, which just shows the importance of the quality of these images. Because the smallest little difference in an image quality, if one little pixel on the machine or on the doctor's computer is out, that can be a difference of finding a breast cancer or not. And so it's very detail oriented. And so, yeah, there's a lot of paperwork that goes into making sure our patients are safe and taken care of.
Yes, thank you for breaking that down, because until somebody understands what all goes into it and the documentation, I mean, a radiologist, I know like breast MRI, when we do them, we have to get certain things from your mammography reports. When was your last cycle? Like, we have to look at, it has to fall within a guideline before we can even do the MRI. If you fall within a follicular stage, we can't do your MRI. Like, there are so many things that go along with it. And then the radiologists, if they don't have priors, they don't have certain paperwork to go, they'll set that to the side till they get what they need. They will not read the MRI because, like you said, there's such fine guidelines when it comes to, you can miss so much. They have to compare. So kudos to mammography techs and radiologists, because you guys work very closely. We talk a lot about IR works really closely with doctors and ultrasound, but mammography technologists, in my opinion, after doing the screening national certification, I was like, the doctors radiologists really rely on you all, and you all work very closely together. And once it started coming into MRI, I was like, ooh, this is a lot. You kind of take for granted what you don't do and what you don't know, even though we all fall under medical imaging. So thank you for educating us on that. Now, they do talk about 2D and 3D. That can be confusing to an average person, even to a technologist. What's the difference?
Yeah, that's a great question. So 2D mammograms is, I think, what everyone was used to, and it's been around for forever. So what that is it was just taking one picture at just one angle, okay? And then probably now about, I want to say about 10, 15 years ago, 3D images, 3D mammography came along. And what it does is it takes a series of 15 pictures at different angles. So it starts here and it takes pictures like this at different angles. And then there's a computer software, technology is amazing, that then that processes these images and then creates it into a 3D image. So what happens is, instead of the breast tissue of everything being stacked on top of each other, the radiologist can scroll through it kind of like a breast MRI or like a CT scan and look at the breast in 1 millimeter layers. So instead of things being on top of each other, now they can look at it, one layer at a time. So it's really helpful for women that have dense breast tissue, because before with 2D, we couldn't see through that dense tissue. And that's kind of what 3D was designed for and created for, was that dense tissue. Now we can see through that overlapping tissue and see, what is it, a mass, or is it just dense tissue that's just stuck, on top of each other.
That is a great example, because I think understanding 2D and 3D is really important, because there are still facilities that have 2D, but really explaining dense breasts, really, and knowing your breast density. I'm going to have a radiologist on that's going to talk about knowing the density of your breast. Like, she is like a stickler on that. And I couldn't say I knew it before until, I had my breast issues. But it's really important that we do know, and then really advocating for yourself which facility might be best for you. And you don't know until you're educated, like Jen just educated us. So is 2D like outdated? Should we not be doing it? What?
3D is really the new standard. And now I would say almost all insurances cover 3D. At the beginning, there was still a handful of insurance companies that didn't want to cover the 3D, and patients had to pay out of pocket if they wanted it. But now 3D is the standard of care. So definitely ask the facility where you're going, which type of imaging you're doing. The other thing would be to also call your insurance company beforehand just to double check that they do cover the 3D, but most of the insurance companies now will cover that. And then just the other thing, like you were saying, the density of the breast, the only way to know that is by a mammogram. So you can feel the breast and say, oh, maybe that's dense tissue, but the only way to know that is by a mammogram.
Wow. Okay. So screening recommendations. What would be your recommendations as a mammography technologist?
So I follow the recommendations that are by the ACR, which is the American College of Radiology, the Society of Breast Imaging, and the National Comprehensive Cancer Network, the NCCN, which is screening mammograms for everyone at age 40. And then if you're high risk, then that would be adding a breast MRI along with that.
Yep. So those are the recommendations from the accrediting board. And Jen, that was a great explanation for people who kind of sum it up. One thing that people really, really are fearful of is the compression. Can you explain why compression is so important?
Yes, I will. I was going to say, I'm sure we've all heard seen the memes and heard the things of flat as a pancake. And I've heard the things of, I have to practice by, shoving my breast in the freezer door. And, yes, we get all of those, those things. But compression is so important. And I think when patients are educated on the reason why we compress, it makes such a big difference. So a couple of things. First is we get a better picture, but I'm going to break that down into a couple of things. We get better detail if we have more compression. The part of the mammography machine that your breast rests on is called the detector, and that's where the most detailed part of the image is. So the closer your breast is to that, so the kind of more compression we give, the more detail there is in the image. In the image, there's black and white tissue, so the dense tissue and then fatty tissue. And the more compression we have, we can see better through that contrast of those black and white tissues. So the more compression we have, the better contrast. Then we have less motion. So that's why your technologist will tell you to hold your breath during your mammogram. But that also helps with compression is so we don't have motion breathing, because if you are breathing during your image, we have to repeat it, and no one wants to have to repeat a mammogram picture, right? Let's get it done right the first time. And then it reduces the radiation dose. So we are working with x-rays, so there is x-ray radiation dose to mammograms, but the more compression we give, the thinner the breast is, and then the less radiation dose. So those are all really important reasons why breast compression is important in a mammogram.
Nice. That was great. Especially now that you explained the 3D. I do have a question. I've had someone ask me this before, with 3D, is there more radiation because you're taking sequential pictures at different, instead of just one straight on?
Yeah, that is a great question. So there is a little bit more radiation with the 3D images. Like I mentioned earlier, we are very heavily regulated. So the recommendations for screening mammograms is that we don't go above 3 milligrays, which is the way that we measure radiation doses, per image. For 3D images, it's about 1.64. A regular 2D is about 1.2. So it is a little bit more, but we're still way under that 3. And then there's some 3D images that will take a 3D picture and it will take a 2D picture at that same time. And we're still, even if they do that, we're still underneath that 3 milligray recommendation. So even though it is a little bit higher, we're still well below that recommended dose amount for the regulating bodies.
That is perfect. I think we've covered so much, but we've got some tips and tricks for scheduling and preparation. I think that's important because I find like with MRI, people come and they will be very claustrophobic based on what the fear that they have of being in closed spaces or what they've heard, what they've seen on TV on one of the TV shows that scared them to death. And I find that when I prep my patients, calling them ahead of time, letting them know what to expect, or if they come in and they're claustrophobic, letting them know, maybe try it in the morning before you do your ripping and running. And that way, or ask the doctor for some medication to relax you, whatever, just giving people tips and tricks to help them be better prepared makes for an easier experience and a happier patient. So what tips and tricks do you have for not only coming to your appointment, but scheduling it and then preparing for it?
Yeah. So first we want to schedule when our breasts are the least sensitive. So you want to schedule if you're menstruating a couple days after your period ends. That way we can get the better compression on the images and it's not as tender for the patient. Then you want to make sure you wear a 2-piece outfit so that you still can keep your pants on and just remove the top. Sometimes women come in a dress and then it's a little bit tricky with the shorter gowns that we have in mammography. You want to make sure you don't wear any lotions, deodorants, or powders on the breast area. Some patients go, why can't I wear lotion like on my legs? You can wear the lotions on your legs. Just in the breast, axilla, armpit areas where we want to avoid that so we don't have any artifacts on the images. The other thing to prepare for your exam is you want to make sure you know your family history, both mom and dad's side, because the techs are going to ask those questions and it's going to help them know if you're high risk or not. So make sure you come prepared knowing your family history of all types of cancers, but specifically breast cancer. And then last, don't be scared, but make it fun. Bring your sisters, come with your mom and go make a girls' night out of it. Go get lunch after. Come with your girlfriends and go see a movie. If you can make it a fun event, it's going to release that worry and anxiety, and you can just make it a fun thing. So I think that's my biggest thing is make it a fun event and bring your neighbor, bring an important woman in your life with you.
You have given me an idea. I am going to do that for October. We're going to have a mammogram party. Go get your mammogram and we can all go and see if we can schedule them on the same day. Oh my goodness, that is a good idea. And then we can go get a movie and enjoy ourselves that evening. That is great. Jen, this has been a great conversation. I wanted to open it up, but for some reason, LinkedIn Live did not connect. I don't know if it's a connectivity issue, but we will use this for the podcast and I will put this on LinkedIn as a video itself. But I'll just actually just do it as a podcast as well. So it'll be audio and video, but I would open the floor for questions because I know there will be, but I do have TikTok running. Someone said that they had the same exact question about the 2D, 3D. So that was great that I asked that. And let's see, I'm trying to scroll through these. Some of them are about X-ray school. Let's see. They love the content. So this was very helpful to a lot of people. Yeah, a couple of people said they had the same questions. So it seems like we answered the questions. And do you have any parting remarks? We appreciate you being a guest on this live and sharing really, really good information. And as an instructor, adjunct instructor, I really love your way of teaching and showing. You kept it really simple, but you made it very powerful. And I think it was very touching how you didn't speak over anybody. You really knew this is a sensitive subject for many people and wanted to really reach the heart. And we could tell you're very passionate about what you do and you're very good.
Well, thank you so much. This has been such a fun opportunity. And I'm very passionate about mammography and breast health. And I think just my parting words would be if you haven't gone and if you're now worried of saying, well, I haven't gone yet and now I'm scared because it's been so long, just go. The mammo techs will be so happy that you're finally there now. And that's what I tell my patients they'll say, oh, I missed maybe 4 years. And I'll say, but you're here now. And that's what's important. So schedule your mammogram, no matter whether it's been a year or 10 years. Go now. And you'll be so glad you did. And the mammo techs, everyone I've worked with, they're great ladies. We're in it for a reason because we are passionate and truly care about our patients.
Well, thank you again. You guys go over to her Instagram. She's got great content. There's a recent post that I love. She's there at the mammo machine. She's doing like a walkthrough. She shows everything. You guys check her out. Her Instagram is mammo_mama. Mammo_mama. So be sure to check her out. I'll put it in the description as well. Let's show Jen some love and support her page and support all the educational content that she is giving us, because she is the real deal and we all need to make sure we take care of our breast health. And thank you all for joining us on a Couple of Rad Techs podcast. Have a good one. I hope you enjoyed this podcast today. Thank you so much for listening. This is just one of the many free resources I offer to my clients to dump unhealthy habits and begin living. Be sure to visit my website for more free resources and health coaching. Again, thank you for listening. Be sure to subscribe, leave a review, and share this podcast with others so they can join the Let's Chit Chat podcast. Have a great day, you guys. See you next episode.